So today we are going to talk about a health concern that, according to the Centers for Disease Control, affects nearly 50% of the population. We're talking about high blood pressure or hypertension. Now, this is a staggering statistic, but what may be worse is that many people have high blood pressure and aren't actually aware of it. It's estimated that around 14% of people with hypertension don't know they have it. And of those who are aware of their high blood pressure, approximately 24% don't have it under control. So this means they either don't receive treatment or their treatment is just not effectively managing their blood pressure. Hi, I'm Alison Acerra, registered dietitian with MedShadow, and today we are going to focus in on hypertension and specifically how we can build a solid nutrition plan that can help us maintain healthy blood pressure levels. But before we do that, it's just really important to recognize that hypertension can easily go unnoticed, as we've sort of mentioned, sometimes referred to as a silent killer, because unlike other chronic health conditions, we don't necessarily feel when our blood pressure rises. This is why it's so important to just know your numbers and make sure you see your primary health care practitioner for routine medical checkups. Now, while there is a genetic component to hypertension, blood pressure levels are closely associated with our lifestyle practices. So what do I mean by that? Well, eating a processed foods-rich diet high in salt, sugar, and fat, maintaining a sedentary lifestyle, smoking, and alcohol in excess are all associated with an increased risk of high blood pressure. Alternatively, the inverse is true. Maintaining an active lifestyle, a healthy weight, avoiding smoking, limiting alcohol, and eating whole, minimally processed foods are also closely linked with healthy blood pressure levels. Now, the dietary approaches to stop hypertension, or the DASH diet, is a well-studied eating approach proven to be effective in reducing blood pressure. In fact, studies have shown that following the DASH diet can lower blood pressure by around 11 systolic points and about 5 diastolic points, which makes an excellent nutrition strategy in tackling stage 1 hypertension. So let's talk about the 5 fundamentals of the DASH diet. Now, overall, this approach really recommends loading up on a variety of fresh foods, fresh veggies, fruits, low-fat dairy, whole grains, chicken, fish, and nuts. These foods are packed with potassium, magnesium, calcium, protein, fiber, which are all associated with healthy blood pressure. And they also keep the saturated fat, the refined sugars, and the sodium levels in check. So number 1, the DASH diet recommends keeping your sodium intakes under about 2,300 milligrams a day, especially if you have high blood pressure. Now, eliminating many canned, packaged, and processed foods is really your best bet to limit those sodium intakes. Number 2, incorporate potassium-rich foods. Now, potassium works at a cellular level to counteract the effects of sodium and help your blood vessels relax. So making sure you're including potassium-rich foods is a big deal. Sources include apricots, lentils, squash, kidney beans, spinach, potatoes with the skin, bananas, avocados. There's so many of them. Number 3, you want to really focus in on fiber. Now, dietary fiber is well associated with heart health and healthy blood pressure due to its cholesterol-lowering benefits, ability to promote healthy weight, and reduce inflammation. Number 4, you want to focus in on healthy proteins like chicken, fish, nuts, and seeds, and avoid those high-fat and processed meats to help keep those saturated fat levels low. And number 5, watch for those processed foods high in added sugars. Now, these can really increase inflammation, which can drive high blood pressure levels. So that about wraps us up. As a review, the DASH diet is a well-researched and effective nutrition plan to promote healthy blood pressure levels. Make sure you really know your numbers, have your blood pressure checked routinely to make sure you are really staying well and on track. Thanks so much for watching, and let us know if you have any questions, and we will see you next time. Thanks so much.